morning. Welcome to Wellness Wednesday. Thank you for joining us today. Our Wellness Wednesday airs every second Wednesday of each month, bringing a focus to a different mental health topic each time. I am Nicole Moccasin, the community health worker for the Ponca Tribe in the Lincoln office. And joining me today is Dr. LuAnne Even, the Chief Behavioral Health Officer of our clinical psychologist at the Fred Leroy Health and Wellness Center here in Omaha. Thank you for joining us today. And today we're going to be talking about the holiday blues and grief. As November draws to an end and December begins, there are many holidays and celebrations that are on our minds. As I think about holidays, another thing comes into mind is holiday blues. Can you tell me a little bit about what it is and what symptoms may be caused?
Of course. So the holiday blues in and of themselves are kind of a temporary feeling of anxiety or depression that occur during the holidays. They're caused by extra stress, some of the expectations that we put on ourselves or maybe placed on us during the holidays, as well as sometimes some memories that might be associated with the holidays. A recent study done by NAMI showed that 64% of people experience holiday blues, and an additional 24% of people say they are affected during the holidays. More than 90% of people in some way are affected during the holiday season. And what the holidays may look like, or the holiday blues may look like, is like fatigue, tension, irritability and frustration, like a sense of loneliness or feelings of isolation, as well as just the general sadness and sense of loss.
So thank you for letting us know about the holiday blues. As you spoke, I noticed many symptoms you spoke of are similar to depression, which we talked about prior. Is there a difference between the two?
The major difference between depression or anxiety and the holiday blues is that the feeling is temporary. However, it's still important to know that even a short-term problem is still to be taken serious, because if it's not taken care of or managed or coped with appropriately, it can turn into longer-term mental health issues.
Okay, it makes me wonder who usually gets the holiday blues. What usually causes someone to experience the holiday blues?
This feeling of the holiday blues can really hit anyone at any time. They're caused, as I said, by just the increased level of stress and expectations that we put on ourselves during the holidays. And some people are affected by the memories associated with the holidays, such as like the loss of somebody close to them, any kind of trauma that may have occurred, or any kind of negative associations with holidays during their childhood. So really anyone can be impacted.
I'm glad to know more about the holiday blues. Another term I hear around this time is SAD, or seasonal affective disorder. Is this the same thing or something different?
I mean, it's something different. Seasonal affective disorder, or SAD, is it's caused by the seasonal changes. So while it tends to coincide with the holiday season, it's different in that it's a little more impactful at times. It's broader and it lasts longer. So it is a mood disorder commonly seen during the winter months as a change in our circadian system. So this can be decreased light that we experience during this time of year. It can be just decreased sleep, and then that is what causes those depressive symptoms that last through the winter months.
Are there any coping skills for someone using or that can use to help lessen their symptoms for these holiday blues?
So while it might feel hard or difficult, it's important to stick to your typical routine as much as possible. Make sure you're getting good sleep. Take time for yourself. So we mentioned earlier there might be a feeling of isolation. So this doesn't mean isolating, but taking time to take care of yourself, whether that means watching a favorite show or going for a walk or getting your nails done. Take that time to take care of yourself. Make sure you're eating and drinking in moderation. If you're feeling lonely, isolated, or down, alcohol is not a good mix for that. But also to make sure you're fueling your body with healthy choices. Set a budget for your holiday activities. When we talk about those expectations that come around the holidays, if we overextend ourselves by buying presents for people or going out, it can increase that stress and therefore those kind of depressive and anxious symptoms. And then also just find ways to cope, listening to music, working out, things that help you kind of rest and reset.
If I or someone I know is experiencing any of these symptoms we discussed today, when does it become a concern and when should they get help?
So it becomes a concern when it's lasting longer than a few weeks or maybe a month, or if the symptoms get really severe. If you're having thoughts of suicide or self-harm, if you're having a hard time getting out of bed or doing the things that need to get done, we're probably looking at something a little more, a little deeper than the holiday blues. And at that point, I would encourage you to reach out. Ponca Health Services has a great behavioral health department that spans all the locations. And there's also therapists that you can find on the internet that are in your local area.
Okay, well, thank you, Dr. Even, for joining us today. And remember, join us Wednesdays for Wellness Wednesdays in December. Our topic will be New Year's resolutions and goals.